Welcome back to Psychedelic Therapy Frontiers, the podcast devoted to exploring the frontiers of psychedelic medicine and what it takes to cultivate a healthy mind, body, and spirit. I'm Dr. Steve Thayer, and today my co-host, Dr. Reid Robison, and I explore the causes of, symptoms of, and treatment options for ADHD. That's Attention Deficit Hyperactivity Disorder. Let us know what you think of these episodes where we focus on a specific mental health condition. We've tackled depression so far, anxiety, eating disorders, and post-traumatic stress disorder, or trauma so far. You can leave your suggestions and comments below if you're watching on YouTube. You can also email us directly at psychfrontiers@novamind.ca. Please give us a rating and a review if you're listening on a podcast app like the Apple Podcasts or Spotify. That helps the show climb in the directories and get exposed to more people who might enjoy and benefit from the show. So thanks for listening, and please enjoy our conversation about ADHD.
Hello, Steve.
Hello, Reid. Welcome to Psychedelic Therapy Frontiers.
I beat you to it this
week. I know.
Week.
I'm okay with it.
You hesitated.
I did. Never hesitate. I'm learning. Yeah, we're still doing our best to come up with ways to sound more energetic. I was showing the intro of our last episode to my kids the other day.
When you said sex.
Sex, yeah. I scandalized my children with that one. Well, my oldest thought it was hilarious. My youngest plugged his ears. No. But, yeah, my oldest was like, Dad, turn. I paused it to have dinner. He's like, no, turn your podcast back on. I want to hear your bored voice some more. And I was like, bored?
Oh. Well, at least it's not boring, right? Unless that's what he meant.
Well, no, so I remember growing up, every time I'd answer the phone, because back in the day before we had cell phones, there was one phone for the household. So someone would call and I would pick up this phone and say, hello. And someone would always say, oh, I'm sorry. Did I wake you up? I'm like, no.
Oh, that's funny.
I just had a fairly calm, as a kid, I sounded boring and sleepy. But what I've been told now as a professional psychologist and therapist is that I have a very calming presence.
Hypnotic.
Yeah. And in certain contexts, very sexy.
So you don't strike me as having a bored voice. And I think you have a good radio podcast voice, in fact.
Thank you.
Mine, I'll admit, is a bit monotone at times, including right now, but we can get fired up with
we're doing our best to be more dynamic. It's not like we've had professional training or anything, but
are kind of fired up.
Yes, fired up for middle-aged mental health professionals.
And our children.
Yeah. Today, we decided to tackle the topic of attention deficit hyperactivity disorder.
This one's for the children.
ADHD. And the many adults who struggle with ADHD. Something we see a lot of in clinic. People who either were diagnosed as kids or who weren't diagnosed as kids, we'll go through it. But I wanted to start with a story from graduate school. I had this supervisor where he was teaching us kind of what to expect. How can you tell when somebody, in this case, children, have ADHD? And he said the first time he saw a kid who, to his eyes, very clearly had ADHD hyperactivity type. He's in this, this was at the Brigham University at the John Taylor building. It's a clinic where they educate graduate students. So in each office, there's like cameras, two-way mirrors, and there are these microphones that, at least at the time I was there, that dangle from the ceiling. So he said this kid comes in, he's probably under 10 years old. I don't remember how old he was. And he immediately goes to like all the things that could be movable in the office and starts playing around with them. And then he gets up on the chair and he leaps off the chair and tries to grab the microphone like it's, Tarzan on a vine or something and swing from one end of the room to the other. And my supervisor's describing this. He's trying to ask the kid to sit down, and the kid might sit down for a second. And if he is, he's fidgeting all over the place. And he's like, oh my gosh, this is ADHD. So I'm remembering this. And then I think back to when I was a Mormon missionary, as an LDS missionary. And as missionaries, you're assigned a companion. So this is a partner that you're with 24/7. The only time you're not with this person is when you're, in the bathroom. And I was sitting in this little church meeting with this missionary companion, and I do not have ADHD. I kind of have the opposite. Like in session, I've had supervisors accuse me of being statuesque. Just I don't move at all. I'm paying attention to who I'm trying to help, but This guy was fidgeting, like every part of his body that could move was moving. I'm looking at him across the room, and he's got his legs crossed. He's bouncing his foot. He's rubbing his nails with his fingers. He's chewing on another nail, looking around the room. So there's a variety of manifestations of ADHD that are obvious to the naked eye, and some that aren't so obvious. But
what do you call the opposite of ADHD? What do you self-diagnose yourself with?
That's a good question.
Besides statuesque, which I quite like.
Yeah, it sounds kind of nice, doesn't it?
Statuesque. We'll keep it.
Yeah.
So what you said about that kid swinging from the ceiling microphone rope, while an awesome scene, it does remind me of the misdiagnosis in so many, especially females, females and some males as kids, but adults of all genders,
right,
when they don't have that hyperactivity or fidgetiness component so strikingly. Traditionally, they were just missed and didn't get the help that they needed and deserved. And we even call it ADHD, whether it's inattentive subtype or hyperactive or combined. So yeah, like you said, there are a lot of different varieties of the ADHD experience.
Yeah, so maybe we should define it for folks. Like, what is ADHD? And I was looking at some other things that it's been called over the years before we really knew what was going on. I wrote them down here. Different labels like hyperactive child syndrome, hyperkinetic reaction of childhood, minimal brain dysfunction, and then ADD, which is what a lot of us knew what it was called. Growing up, there was this bifurcation between ADD and ADHD. But according to current diagnostic labels, it's all attention deficit hyperactivity disorder, ADHD, with 3 subtypes, if I remember right. There's the predominantly hyperactive subtype, predominantly inattentive subtype, and then the combined subtype.
Yep. And so it's always called ADHD. There's not even technically an official term ADD anymore, even if you're of the inattentive subtype.
Right. And it's characterized by difficulties paying attention, hence attention deficit, difficulty sustaining attention, so keeping your attention fixed on one thing, in difficulties tolerating boredom. You're sort of jerked around by external stimuli, so you're not distracted necessarily by internal thoughts as much as you are distracted by your external environment. A lot of times people with ADHD struggle with rejection sensitive dysphoria. We can talk about what that means in a minute. And then, so that's kind of there's a feeling of restlessness, keyed up, driven by a motor. Like you were saying, in kids, you see the hyperactivity, particularly in males, more than you would in females. That's just sort of how it manifests. Pressured speech, interrupting people, losing things, problems with working memory, problems with memory retrieval, because in order to encode a memory, you have to attend to the information that you're going to encode. So a lot of people with ADHD have trouble with memory as a result of their difficulty paying attention or sustaining attention. Trouble with what we call executive functioning. Do you want to talk a little bit about executive functioning and what that term means?
Yeah, because when we talk about the diagnostic criteria for ADHD, we're talking about how this manifests as the symptoms we can observe or easily query in asking people about their experience, or parents or partners about how they behave. But really, there's a lot more going on underneath the hood. And I like to think about ADHD as, it's a different way of filtering the information that comes in. And it's a different way of self-regulating, some challenges in self-regulation, and executive function sums it up really well. I think it would be more appropriately even titled something around like an executive function disorder or condition. But I did write down the 7 domains of executive function from Barkely, one of the thought leaders of ADHD, because I think they're so useful.
Yeah, let's go through
And
them.
The first one is inhibition. Like you mentioned it in like the symptom of interrupting people's conversation. It's hard to not blurt something out when you have ADHD. The second one being self-awareness. There's just not as much of an ability to observe oneself. It can still be cultivated and developed, especially with treatment. But and we could talk about that more. But then the third domain is it's around the nonverbal working memory that you mentioned, but less ability to visualize something,
Right.
or to remember the visual images of something. And then the fourth one is about the mind's voice. Like it's less of an ability to have a dialogue internally using language. You know how as kids we talk to ourselves more, and then as we develop, that kind of goes internally.
Yeah,
and
around like 10 years old.
yeah, it's a delayed or differential development trajectory of that. And then the fifth is a big one that I like to highlight because it was an area of early interest and research for me, is emotional regulation in ADHD. In fact, here's a tangent, but when I started out in psychiatry, one of my first mentors was Fred Reimer. He taught me to do clinical trials. He's also an ADHD thought leader, along with Paul Wender, who passed away. And we worked with Steve Ferrone and others, and they had developed the Wender Reimer adult ADHD scale and the Wender Utah measure. And then together we psychometrically validated, published it. And it was one of my first publications, actually. And I remember getting a call from 17 magazine to the clinic at the University of Utah. They're like, we would like to interview this Dr. Robison about this paper finding that females with ADHD presented with more emotional dysregulation. I was like, oh no, how is this going to be received by the literature?
Yeah.
But I truly believed and still firmly believe that emotional dysregulation is a far too often overlooked important component of the condition, and that has far-reaching consequences for so many people of all genders in their lives.
Yeah, absolutely. I mean, it's connected to that term I mentioned earlier, the rejection-sensitive dysphoria that people with ADHD tend to have, where they develop this self-consciousness because they're often given negative feedback from people in their early lives, from parents, from teachers, from coaches, whatever. And so they don't develop a really good sense of self. Their identity development is perturbed over time. And so they get really, really self-conscious, or they can. So you add sort of just the neurological, I don't know if deficit's the right word, challenges to developing emotion regulation. And you combine that with just this negative reinforcement, this punishment, really, for being you in the world. And they can get really, really sensitive to rejection.
There's so much to talk about here. I'm just making these mental footnotes to circle back on labels, the good, the bad, and the ugly, and this whole idea of kind of neurodiversity and ADHD as a spectrum. But back to the executive function categories, and executive function in general is this collection of symptom domains largely governed by like frontal lobe and other parts of the brain. But it develops over the first 30 years of your life. And in ADHD, it's just delayed development on average by, say, 20, 30% or a few years, a handful of years, and different in everyone, of course. But after emotion regulation, there's two more categories of self-motivation, and then the last one, problem solving and planning. And that last one I think is key as well, is ADHD is disorder of being able to organize oneself over time.
Yeah. Which, the problem solving and planning, and the one before that was
self-motivation.
Self-motivation often makes people with ADHD very susceptible to procrastination. Like a lot of us procrastinate, I would say most of us procrastinate for a variety of reasons, but people with ADHD are way more vulnerable to falling into habits of procrastination for those reasons, I think.
Yeah. In fact, you could even call it intention deficit disorder rather than attention, or it's like self-regulation challenges across time. And therefore, some of the therapy that we'll talk about later, some of the remedies, the life hacks, the modifications that go so far in helping someone thrive with this condition, they're interventions you put in the real world across time to help you, like reminders and lists and alerts and rewards and accountability and things like that.
I like that. Intention deficit disorder, because it makes sense. If you have a brain that grew in such a way that that makes you very, very susceptible to your environmental stimuli, right? You're sort of jerked around by environmental cues. It's hard to have a solid, I'm thinking of like those ships that break through ice.
Yeah.
You know, you don't have this sort of solid intention that carries you through all the things that could divert your path when you have an ADHD type brain.
And I like that analogy. Another way to look at it, or another title we could come up with for it would be something like time blindness or time neglect syndrome. Just because if you look at a kid, stereotypical kid with ADHD, just playing with toys, bouncing from one thing to the next, having a jolly good time, but no sense of time or where they need to be or what they need to be doing. That, while beautiful in some ways, can present some challenges when you have a deadline or somewhere to be or a boss breathing down your neck.
Right. Yeah, I heard one expert say it's like being stuck in the now. And, you know, we talk a lot about being in the now in different contexts, right? Mindful presence, taking yourself out of the worried future or the regretted past and be in the now. This is different, right? This thing we're talking about with the ADHD just being totally captured by the stimuli of the present moment.
And to get like both psychedelic and philosophical about it, that ability to govern oneself over time and organize one's narrative, we call the ego sometimes, or the default mode network. And ADHD certainly touches on the default network. And it just reminds me of the fact that we need an ego, right? You need a little bit. The question is how to keep it in check. And if you are fully 1,000,000% in the now all the time, you're going to have some trouble.
Right.
Like there's a reason our minds wander and back and forth. It's about striking that balance and flowing and fluidity with it.
Yeah, and a lot of the problems we attribute to the ego are problems of an infected ego. You know, it's an ego infected by negative beliefs or by traumatic conditioning. So it's not that the ego itself is bad, like you say. You've heard you say in the podcast, like we need enough ego so much that we don't get hit by a bus. Like we need some executive control, something that helps us project and plan.
Yeah, that's kind of a Zen teaching or koan that stuck with me for years, is just that idea of like, oh yeah, like there's a reason for the ego, and we should dive into that on a future tangent, because it's really interesting to think about. Yeah,
I mean, unless you're an enlightened being, you're not spending most of the time in the enlightened present. You know, you're spending most of the time in ego, so you might as well get acquainted with it and
chopping wood, chopping
water, and carrying wood. That's how I'm going to say it from now on.
Chop water,
carry wood,
like Steve said. So your ship and ice analogy makes me think of another ADHD analogy, that what we diagnose as ADHD, let's say it's like 10% of the population and climbing, and it is climbing for a variety of reasons. That's the tip of the iceberg, and beneath it is the rest of the spectrum of ADHD, or say executive function, attentional abilities, self-regulation, that we're all on somewhere. Yeah. And underneath the surface, there's still a undiagnosed subset of ADHD, and there's also kind of this sub-threshold group that has some symptoms, but not enough to warrant a diagnosis and maybe a medicine intervention, or it shows up in certain settings, but not others.
And that's in part because of the way we diagnose mental illnesses, conditions, whatever you want to call them, is there has to be significant distress, disability, disturbance present in major areas of life in order to actually qualify for a DSM diagnosis. So you can have somebody who has, for whatever reason, developed a lot of coping strategies over time, but they show up at their doctor, and because they've learned to manage pretty well, they don't get the diagnosis because they're not completely floored or disabled or what have you by their symptoms. But if we were able to diagnose ADHD with a brain scan or a blood test, they would still have it. And I think, incidentally, most of the conditions that you'll find in the diagnostic manual, I think we're headed toward a more spectrum understanding or formulation of mental health conditions for a lot of the categories, not just autism spectrum.
Yeah.
I think OCD spectrum, eating disorder spectrum, and in this case, ADHD spectrum.
Yeah, it is, because there's disordered eating behavior patterns that many or most of us experience at some point in our lives. Same with like body image distress. And then there's eating disorders. And the qualifier, like we've discussed in past chit chats on this show, is brings up the challenge around labels. And one thing I like to point out around ADHD is, it is a real condition. It's a neurologic, genetic, brain-based, with some environmental factors. It's a real thing. And whatever we call it, we've come up with all these different names. That doesn't really matter. And we're all on the spectrum somewhere. But the fact of the matter is when you get a diagnosis of ADHD, it opens the door to resources that can be so helpful, like resources, accommodations in school, or the body of evidence that's growing and huge of how you might manage it in your own life that you could draw from. And thankfully, the stigma around ADHD and mental health conditions in general does seem to be diminishing, but there's still a long way to go. And I say this with a disclaimer that, I hate labels too, but I do see the value of using the label wisely for getting some people help that will go so far in their lives. And maybe we can talk about the consequences of untreated ADHD a little bit too.
Yeah, I agree. That's the virtuous spirit behind something like the DSM is, we need to label these things, these collections of behaviors, of patterns, and give them some kind of label so that we can communicate about these patterns that we notice in an intelligible way as clinicians, so we can research them.
Yep.
And they're not going to be completely discrete, which, as we've talked about, which is why I think we're talking more about spectrum. And certainly, as you implied, labels can be unhelpful if stigma is associated with the label. Or one thing I've noticed as a therapist, if people over-identify with their labels. So if I've got a client who says, I have ADHD, so I can't X, Y, or Z. You do have limitations, or at least neurodiversity is what we're calling it nowadays. You have a diverse brain, which gives you some superpowers and maybe some challenges. But to say, I can't because of this label, I think there's danger there. There's danger of limiting yourself.
There's also danger in denying the label and blaming something else. Right. Like blaming your upbringing that you're not going to change, or blaming, just blaming your mother, which is tragic in and of itself. Yeah,
or the government or Facebook or, I think you're making an important point.
Yeah. And mothers were blamed for so many things, like we've talked about.
Thanks, Freud.
I know. It was really unfortunate because families, parents, spouses, siblings, all of it, the families are some of the best allies for treatment. And you think about ADHD and these interventions we're talking about of hacks in your life, in the real world, in the environment where you go and learn and work and interact with people. You need some allies in that kind of path towards finding out what works for you in life.
Yeah. I think I mentioned this on the show before, but I heard a geneticist say that, parenting doesn't matter, but it makes a difference. And I think the point he was making is like, if whether or not you're going to develop ADHD from a genetic and neurological perspective has very little to do with what your parents do. Now, certainly ADHD there's some evidence that suggests it can be caused by like a in utero infection or something like that. Or people whose moms drank a lot of alcohol while they were in utero are more likely to develop ADHD.
Oh yeah.
Or if you were the result of old gametes, if your parents waited until their mid 30s or 40s to conceive you, the longer you live, the longer your sperm and ova have a chance to mutate. So you're more likely to have certain neurological conditions.
That's an interesting one, because I know we're talking about don't blame the parents and some very real ties to like parental age and some of these things like ADHD and autism spectrum disorder. But we still don't blame anyone, and there's still no guarantee at any age that you're going to pass on anything in particular. But genetics is a big roll of millions of dice.
Millions of dice.
And from age 20 to 30, the number of mutations that show up in sperm and eggs, especially in sperm, is like 8 to 10 times increased over that decade. And then if you look at the genetics of ADHD, most cases of ADHD are predominantly genetic. But of those, that doesn't mean they're all inherited within a family. Some of them are new mutations that showed up along the way, like we're talking about. That's one of the ways they can show up like that are passed on. That's about like 10% of the genetic cases. And the others might be, you see it running through families, even if it's subclinical, subthreshold in a parent or sibling.
And there's some cases that I think sort of follow that diathesis stress model where you have a genetic predisposition, but if there aren't the certain environmental triggers that could unlock that predisposition, you're not going to develop the symptoms. There's some question in the literature and among experts about what about the role that trauma plays in the development of ADHD. We know that we cite Gabor Mate occasionally on this podcast because of his work with addiction, his work with ayahuasca. But he's adamant about the connection between ADHD and trauma, and I think he overstates it. And I'm not going to claim to be a complete expert on the connection, but
I'll tell him my opinion. And we love Gabor, and I've had many interactions with him and fun debates that were scary at first, but he's such a wise kind of enlightened teacher, and I also believe that there's a risk of chalking all of ADHD up to that, because the fact of the matter is, like you mentioned, there's about a third of ADHD cases that are from neurological injury, whether it's in utero or after. Like in utero could be, prematurity and toxin exposure and infection, and after it could be like lead poisoning and brain injury and things like that. And sure, those are traumas of their own, and it's all semantics. But I think we need an open-minded, receptive stance to all of this and all the possibilities. And in ADHD, there's a growing body of literature. Like I mentioned, I started in ADHD research back in 2009 or so, and nowadays there are about 30 to 40 papers coming out every week on ADHD, 1,000 plus every year.
That's wild.
And just to give an example, in the last year it was discovered that there are 2 waves of ADHD age onset in females. Which it gets really interesting because the diagnostic criteria has for years stated that these symptoms need to be present before like age 12, right? But the second wave of onset in females that was discovered within the last year is age 13.
Yeah, it's the onset of menses, right? It's because of puberty. This is what the speculation is, because of puberty. So you have these changes in hormones that either exacerbate the symptoms that were already there but were undiscovered, especially like we said in females, because it's less obvious. I heard Russell Barkley say that one of the reasons boys get diagnosed more often, apart from the fact that they tend to have the condition more, like 3-to-1 to girls, is that they're a pain in the ass. Like a boy with ADHD tends to be more of a pain in the ass than a girl with ADHD. He describes a girl with ADHD being somebody who maybe is really chatty or, a little dramatic or whatever. These are stereotypes, but these are just the things that tend to go with the gender assigned at birth. But whereas boys, you'll bring your son in to see the doctor to get assessed because he's failing at school or he's breaking shit or he's hurting himself because he's impulsive, or the emotion dysregulation tends to be more difficult to parent than maybe stereotypically for a young girl.
Yeah, and on the genetic front, it's interesting to think about how there are dozens and dozens, probably hundreds of different genes contributing to the genetic component of ADHD, and they are overlapping Venn diagrams, like I think, were alluding to. It's not really one or the other, but what I wanted to point out is that in mental health conditions, you can look at the heritability, like the percent of it that's attributable to genetics, and these come from twin studies. And Paul Wender, who I mentioned, one of my early mentors, was kind of a pioneer in some of these for schizophrenia and for ADHD. But ADHD is about 75% heritability, higher than depression and other things like that. It's about the same as height.
Interesting.
Yeah. But because there are so many different genes that could be contributing, and sometimes more than one, there's one example of if you inherit this genetic variant. I like variant rather than mutation. I don't know, depending on what I'm talking about.
It sounds like it's Swamp Thing or something.
Yeah. If you have a variant in a dopamine gene that gives you a little bit of a thinner cortex and therefore has some impact on these domains of executive functioning, that can show up as one of the manifestations of ADHD. But it's also a very treatable one because it's really just delayed thickening of the cortex that comes later in adolescence. So it's highly treatable in the short term, and it's one of the maybe 50% of the cases that don't persist into adulthood. Right. And so you can treat it when it shows up, and it resolves, and often doesn't require lifelong treatment. And it's largely a genetic origin.
It sounds like it's a good case for accommodations when a person is young who has that particular presentation, because if they're struggling because of this delayed maybe development due to the cortical thinning, then they're going to struggle. But if we know they're going to catch up eventually, we have this window in childhood where they could experience some trauma related to their condition, making them harder
Bullying,
to teach. Yeah. Not getting the same positive reinforcement from their parents,
Have you ever read the book Outliers by Malcolm Gladwell?
Yeah.
It reminds me of his fascinating discussion of birth date and where you are in age and kind of neurodevelopment when you enter like elementary school and beyond, and how if you go in with a little bit more physical and brain development, that opens up earlier on some of the gifted programs, some of the sports opportunities, and the gap widens. You might have been 6 or 9 months older than someone else in your class, but you might have gotten new opportunities that helped you flourish at an unfair rate.
Right.
And it's not true across the board. These are trends and just interesting things that we may not think about, forces at play.
So a couple of other interesting things, like just ADHD factoids. So people with ADHD tend to be more vulnerable to developing addictions, whether they're addictions to substances or to behavioral addictions like internet gambling. Because
of that different ability to self-regulate and impulsivity.
Right.
Yeah.
Yeah, and there's some neurological stuff. We're not going to go into everything, but there's some neurotransmitters implicated in ADHD, and it's not just dopamine, right? It can be norepinephrine. It can be a lot of things. There 40% of people who are diagnosed with ADHD have serious sleep disruption. Something I looked up, thought was interesting. And that's one of the recommendations for kids as an intervention is make sure, I mean, this is true for all humans, make sure you're getting really good sleep. But kids with ADHD in particular, if they're having sleep disruption, either because of obstructed airways, you can get their tonsils out or something like that, or just bad sleep hygiene.
Yeah, like you mentioned, sleep is bottom of the pyramid stuff. Ask Matt Walker, sleep guru, or Andrew Huberman, and all those guys who like to talk about it a lot. Of start with getting your sleep in order.
Yeah, it's not just a trend, folks. Like, this is hard science.
Yeah, we've been seeing that in mental health for quite some time, and now it's becoming kind of, discussed more in popular podcasts and on social media, which I think is really helpful to a point. Of course, we don't want to sleep shame anyone, and I'm a big fan of using some kind of 80-20 rule. Like, let's aim for good sleep, but give yourself some credit. It's like last night, I was woken up to a knock on my door at 3:30 a.m. by one of my twins who had a cough, and it was I knew he had a cough while going to bed, but he just couldn't sleep and wanted some medicine, a humidifier, some comfort. And so, I mean, what am I going to do? Beat myself up because I didn't get a perfect night's sleep? I never get a perfect night's sleep, but I strive for better and better sleep. But yeah, give yourself some credit for trying and for any little bits of progress. Yeah.
I'm a big fan of that, Reid. I'm a big fan of the balanced approach because, you and I kind of geek out in the human optimization world and the sort of quantified self world. So, people who will have some wearable technology or a mattress or something like that tracks their sleep, and they get a sleep score, or it shows them the sleep, stages that they're in, and they can kind of get wrapped around the axle about whether or not their sleep score was perfect. And you can have this weird, I think, would you call it a nocebo effect? Like you're probably well rested enough, but because you're looking at your sleep score and you're getting a little too bent out of shape about it, your day is worse than it needed to be.
No, it's a good point, because that could be a nocebo effect, meaning the placebo effect in a negative way, when you believe something's going to harm you, and so it does more than it would if you didn't have that belief. Because I remember listening to an episode of Ben Greenfield's podcast when he was talking about his sleep score on the Oura Ring, which I use as well. I'm not wearing it right now, but I had it on last night for my, very kind of brief or reduced or interrupted sleep. But I remember thinking for 1 second, like, whoa, he has that sleep score that's near perfection. How am I ever going to get that? Like, my HRV is so much different than his, but I had to quickly just like chuckle at that thought and let it go and let it really go, because that's not going to get me anywhere.
Man, yeah, as if Instagram wasn't toxic enough. Like looking at people's fake butts, or all the guys on roids that look amazing or starve themselves for a photo shoot. But now we're going to compare our sleep scores. So I like what you said about not sleep shaming for that reason.
Yeah, I don't know if that's a term, but we just made it one if it's not.
Trademark Reid Robison. I like it. No sleep shaming.
The sleep shame scale or something.
Boredom intolerance. I think we kind of talked about that a little bit. People with ADHD are a little less tolerant to boredom. So they're more likely to engage in these sort of high reward, immediate reward, intense activities. Maybe we can talk a little bit about what ADHD is not, because certainly stimulant medication is prescribed to a lot of humans on the planet right now, some of which probably don't have what we're calling ADHD. Yeah. They might have problems with attention. They might have problems with memory. As adults, hyperactivity is usually not much of an issue, as much as it is as kids. But, ADHD is not just occasional trouble focusing because of a stressful life event, for example. ADHD is not your shitty attention span because you spend a lot of time on scroll media, right? A lot of people will say, it's probably been studied, but at least colloquially, that our increased screen time, our increase with the devices that give us pretty rapid variety, is probably reducing our attention span. It's the muscle that if you don't use, you lose, right? But that's still not screen-induced ADHD, at least in the way that we're defining it, right?
Yeah, it's one part of the puzzle, like maybe even a small part, that attention that's trainable, like all of this stuff, but doesn't in and of itself represent what we're talking about here.
Right.
Yeah.
Yeah, and I've heard Russell Barkely also say that kids with ADHD tend to be more drawn to screens than somebody who's neurotypical, in part because of that rapid, quick changing stimulus. So it's actually more of a drug hit for them than it would be for a neurotypical individual.
And in fact, when he wrote one of his recent books, I think an ADHD for Adults book, he did some field testing through the process and broke it down into ADHD-sized chunks to digest of little mini sections.
Yeah.
That I thought was smart.
Yeah, that's cool.
Yeah, and another myth of ADHD I like to face head on and address is I've heard so many times people say that, oh, if a stimulant works for me, it means I have ADHD.
Right.
But no, stimulants might be quite performance enhancing for many, 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 many people.
Yeah, the taking of a medicine is not a diagnostic tool. It's it's a treatment, but most people who take a dopamine agonist are going to feel great. So that doesn't am I getting that term right? Like, it doesn't mean that you necessarily have the condition.
Yeah, it's not diagnostic in and of itself, although what happens during treatment can be very valuable as far as information goes and can be reinforcing about diagnosis. And we can get into this more when we talk about meds, but stimulants are also really interesting in that there's a sweet spot, whether you have ADHD or you don't. If you take too high of a dose, that's not going to feel good.
Right.
That's going to show up. It's going to be counterproductive. And also there are about 10% of people with ADHD who just do not respond to traditional treatments, whether it's stimulants or non-stimulants, whether it's because of inability to tolerate it. It might just give them too much anxiety, insomnia, loss of appetite, or whatever, or just non-responsive. And so that also highlights that, you don't need a drug response for a diagnosis.
Right. People will also talk about the memory and attention impairment in other conditions, like mood and anxiety disorders. Pretty common for somebody with depression, for example, to procrastinate or to have trouble paying attention, to have trouble with memory. But the distinction that I've heard made is that while ADHD is distraction because of external stimuli, like I've mentioned a couple of times, depression and anxiety is more of an internal distraction, right? You're distracted by your rumination. You're distracted by, your regret about the past, about your hopeless thoughts about the future. Or in anxiety's case, you're distracted by worries about what might happen. Something bad is going to happen. And so it's hard for you to focus in the present moment because you are, distracted by these fears or by these intrusive thoughts, for example.
Yeah, and there are a lot of overlapping symptom domains across different mental health conditions, like childhood or adolescent bipolar and ADHD are so often confused because of so many symptoms overlapping. And like you mentioned, in adulthood or in childhood, depression, even schizophrenia with the cognitive impairments, there's some overlap with attention deficit disorders. But it just, for me, it highlights the fact that these are conditions impacting multiple circuits in our brain, and sometimes in similar ways, sometimes in different ways. But we're looking in the best way possible with these imperfect diagnostic criteria and trying to describe them to really be able to help people and learn and understand them better and offer evidence-based treatments.
Right. Yeah, another thing to note about those connections is that somebody with ADHD, because of the struggles that condition occasions for them in their life, it's been observed that they are more likely to develop mood conditions later in life as adults, more likely to develop depression, more likely to develop social anxiety, maybe even more likely to develop an eating disorder. Like those negative experiences will predispose you to developing those mood conditions. So they're not the same thing, but they're connected.
Yeah, and the connections can get pretty discombobulating sometimes when you look at, how many people with ADHD, like 50% of ADHD also has a learning disability, for example.
Right.
And then you mentioned eating disorders, and I did, and we mentioned them a lot because we work with them a lot. But there's even data on if you have a serious eating disorder, say anorexia, and you have ADHD, it's a little bit harder to treat the anorexia, for a variety of reasons. And so there are these kind of dynamic interactions between a lot of these neurocircuits we're talking about.
Right. Yeah, and I think one of the reasons that those combinations might be difficult to treat is just because of the learning challenges that somebody with ADHD has. So I'm speaking at least from like a psychotherapy treatment approach. Because in order for you to benefit from what I do with you as a psychotherapist, you got to be able to learn, right? In some ways, the therapeutic relationship is a teaching relationship, and there are different ways to learn and different ways to communicate ideas.
Yeah,
certainly.
You have to be able to sit still and listen long enough to engage in a therapeutic dialogue.
Right. And I think habit formation is tough for people with ADHD just because of all the things we've talked about, being consistent.
Yeah.
We'll get to treatments later, but any other causes that we want to talk about, or what ADHD is or is not?
Yeah, so one other thing that's semi-related that I like to point out, because we're talking about all these challenges of ADHD, I like to point out the superpowers that come along with ADHD, or the other side of the ADHD coin that actually can bring a lot of creative, entrepreneurial spirit and dynamic kind of interpersonal way of showing up in the world, and sometimes a boundless energy that can be quite positive things. I kind of see it as superpowers that just need to be channeled and trained, and they can go a long way.
Yeah, we were talking before we hit record, and I was talking about one of my children who has ADHD, and I'm amazed at what he can learn, at what pace he can learn it, because he has no inhibitions. Like, he will just try stuff.
Yeah.
And I'll watch him play these video games, and it's just like, he doesn't get stuck in a rut of how to play this particular game. He's just like, oh, I want to try that, or I want to do that, I want to do that. Just no inhibition. And I think a lot of these kids who are like really, really fast, they have really fast motor movements. This is total speculation for me, but like on a controller or a keyboard and a mouse, part of that's because they don't have the same inhibitions that a neurotypical person might have. And if you wanted to click a button really, really fast, it's not necessarily about gaining quick motor control. It's about turning off the inhibitory signals, the ones that tell you to not go that fast. So I don't know, it's just a pet theory.
Yeah,
of mine,
it's reminds me of one of the tests the computerized tests we'll often give for ADHD, where you're just tapping something repeatedly, and when there's a stimulus, you need to not tap, or it's testing your ability to halt that impulse.
Right.
And have you read the book or seen the movie Ender's Game?
Yeah.
Reminds me, your son's experience reminds me of those little kids in there
Floating around in outer space.
Yeah.
Killing aliens. Yeah.
Yeah, and they're in the now, and they're really trying anything, and it can be a beautiful thing, and it can drive some teachers nuts, but sometimes I like to think about, like, is ADHD really what's dysfunctional, or are we in a dysfunctional society?
I have thought about that a lot. Like, I think a lot of what we call dysfunction is just a mismatch between, a person and their environment.
Yeah.
I think the typical Western education system that, according to some, was really just built to train us to be really good factory workers with bells and schedules and things like that. Probably not conducive to a kid with ADHD, right? You have to sit in a chair for 6 hours and learn just by listening and reading. Whereas, a lot of kids with ADHD, people with ADHD, learn better by doing, by feeling things with their hands through experience. And so they might be better as an apprentice than, learning from a book.
Yeah, you have an energetic, budding young, creative dancer who's stuck in a classroom for 6 or 7 hours and expected to conform and sit in this chair and not express themselves in that way. That's a tragic situation to put a kid in, even though I realize that, we have schools for a reason and there's importance to them, but it does highlight for me the need to celebrate the children and their creative abilities and give them channels and outlets for that.
Yeah. One sort of school hack that I'm aware of, there's this physical therapist I used to follow on YouTube and stuff. His name's Kelley Starrett. We've talked a bit about his stuff. He wrote the book, The Supple Leopard and Desk Bound.
I like his stuff.
He's got great stuff. Really creative way of addressing physical problems. But he and his wife, Juliet, they went on this quest to make schools more healthy for your body. But one of the things they created was this standing desk with a fidget bar. So,
cool.
And they got their school that their kids went to put all these desks in. So none of the kids were sitting down. And the fidget bar was for their feet. It would rock back and forth. If they had to sit down, they would sit down on stools that had a concave bottom or convex, whichever one is it's like a little dome, a little rounded. So the kid couldn't just sit and lean back. They were moving their core around.
Yeah.
And they found, the teachers observed test scores went up. A lot of the kids that had resource or they had 504 plans or whatever, who had ADHD, they were able to pay attention better because they could move. And there's some treatments that do this for kids where they'll try to teach in conjunction with certain motor movements.
Yeah.
That tend to help.
Fascinating. I think we were joking once about those little exercise ball chairs that people use, or how cool that would be if we had them underneath us for the podcast. We'd just be bouncing up and down.
Well, you're the posture king. I always tease Reid about his excellent yoga posture. Well, as I'm slouching and hunched over like the true desk-bound man that I am. But
well, the fact of the matter is that we're all born to move, and we're sitting here stuck in seats and desks and cars and airplanes for far too long. And there's this thing, are you familiar with forward neck or forward head
nerd
syndrome?
neck?
Yeah. It's fascinating when you look at what's happening it's not just texting neck, although that's a striking, one of the causes and manifestations of it out there in the world, everywhere you look, people looking down at their phones. But the way car seats and airplane seats are built, it puts you in this
kind of turtled position,
hunched forward posture that happens to be more crash resistant. But it happens to not be that great for our posture, for our spines, and for our psoas muscle that connects the upper body and lower. And so it's definitely worth thinking about in one's own life, the role of those standing desks and getting up and walking throughout the day and just moving in different ways throughout one's life.
Yeah, as a psychologist, I wonder about the emotional implications of having a posture that tends to mimic sadness or smallness.
Oh yeah.
Head forward, rounded shoulders. I mean, sometimes in therapy, I'll just have people who are assuming that posture, just change their posture and see how you feel. There are these fun studies that are famous that, they gave people questionnaires to rate their happiness, and then they had them hold pencils in their lips. And in one condition, it was hold the pencil sideways to mimic a smiling motion, and the other was to hold the pencil eraser first. So you kind of purse your lips to mimic a frowning motion. They were just trying to stimulate the muscles associated with smiling and frowning. And they found, they didn't tell people to smile or frown. So, but what they found is that people, as you might expect, who engage the frowning muscles reported, a decrease in their mood.
Yeah, I love that. And I have done that countless times as well with clients or groups where I'll be like, okay, everybody hunch forward and slouch and assume the most depressed, defeated posture you can possibly imagine, and then say something like, I am strong or powerful. And then broaden the shoulders, kind of puff out the chest, or imagine yourself stepping into that superhero suit and cape blowing in the wind. and now say it.
Yeah.
And it's different. It is different.
Definitely.
Because the form and function, like our emotional mental state and the form we assume are so interrelated. We don't give it enough credit. And I think that's one of the beautiful things about somatic therapies coming into our mental health world for trauma and other conditions is that when you change the form, the structure, it's an accelerated path to changing the mental emotional, I think.
Right. This makes me think of, I've over the time developed this interest in the primal or ancestral movements in diet and in exercise and lifestyle design to try to get back to the way our bodies evolved to be, and that we evolved to move. We evolved to sleep certain times, we evolved to eat certain foods.
Yeah.
There's variation, of course, but we have problems in our modern day that are problems of our modern environment. So like, type 2 diabetes might be an example of that. Not a whole lot of that back when we weren't over-consuming certain kinds of foods. Or I've developed bursitis in my elbows, like just on the tips of my elbows. And I looked it up, and it's called student's elbow or baker's elbow or they call it Popeye's elbow. But it's from, resting the tip of your elbow on desks or chairs because I sit in a chair for a living and, in my therapist's pose, lean on my arm or whatever of the chair. And so, now I'm 39 and I have like bursitis.
You have baker's elbow.
Yeah.
Huh? Yeah. I went to ecstatic dance the other night.
Oh yeah, you did.
And it was so fun. And for those who don't know what ecstatic dance is.
Yeah, please explain, because I'm imagining what people are imagining.
I've heard it called eccentric dance. I've heard it called static dance. I've heard it called a lot of things. But
freaking weird.
Ecstatic dance is this beautiful, I consider it therapeutic practice of just freely moving without judgment. And our dear colleague and friend Hannah, who we've had on the show and need to have on here lots and lots more, she does it in a way that's called trance dance that has blindfolds, which I think is a brilliant idea. This one the other night, it's not blindfolded, but there's no cameras allowed. You can't, and there's no judgment allowed, and you just freely express yourself. And there was this DJ, and he had this electric violin, and it was amazing. And then at the end, there was a circle. 170 people were there in the Salt Lake Krishna Temple. Wow! And there's this giant circle after for sharing. And I remember one gal's comments that she said tearfully, and it gave me the chills, and probably everyone else in the room, when she just said she has never felt so free, and she was feeling so stuck and so stagnant and so discouraged, and now she was just so full of like hope and this aliveness from just moving your body in a liberated way.
Right. Yeah. She didn't take a medicine. She didn't sit down for an hour of psychotherapy. She just moved her body in a container where there was no judgment. Yeah. That's beautiful.
Yeah, we got off on a little tangent.
Can we find our way back to where we started?
Everything is related.
That's right. So we were talking about the education system not being well suited for people with ADHD, but
here's the thing about ADHD is yes, it's a spectrum, and yes, we're all on it, and yes, it's a real condition in need of intervention for so many people because there are consequences to it. Like we were talking about. The longer you wait to get help, the further delayed you can get in school, and that can have far-reaching implications on how you're doing and self-esteem and things like that. The impulsivity can have consequences in drug use and car accidents. In fact, there are some very striking studies on the mortality rate of ADHD, untreated ADHD, that are just shocking in that one of them found a 13-year decreased life expectancy.
Wow.
From untreated ADHD, in large part due to car accidents.
Yeah, that would make sense. So there's good reasons to get it. There are good reasons to get it treated. So do we want to talk about treatments? Do you feel ready to move to that chapter?
Sure. Yeah, it's one of the most fun things for me as a psychiatrist to treat when we're talking about meds. I'm a big fan of always involving therapy alongside meds and the judicious use of meds. And I also am very well aware of the risks of stimulant use. But when treating ADHD, when there is real ADHD and there are widespread impairments in multiple areas of life, the success rate for treatment with medications, mostly with stimulants, but others as well, is some of the best we have in psychiatric prescribing, in that like 70 to 80, sometimes up to 90% of people respond to treatment very quickly as well, like with a 50% plus reduction in ADHD symptoms. And if you look at remission rate, meaning getting the symptom impairment down to completely normal range, it's like 55+% of people just no longer would even meet criteria for ADHD after a course of treatment. Mind you, they need to stay on these treatments in general.
Yeah, we don't have that with a lot of the other conditions we treat. We don't have those kinds of remission rates.
Yeah. And we talk about it in the how exciting MDMA-assisted psychotherapy is for PTSD because of this like 67% chance of no longer even having PTSD after a course of treatment. And that, while there's a lot of hours of therapy tied to it and several doses of MDMA, that's amazing for PTSD. For ADHD, I should clarify that you don't have to stay on the meds for life. Like ADHD does not persist into adulthood and the elderly years in everyone, although it can. And there are many people who do a course of meds and get off them. But it also is not like psychedelic assisted psychotherapy where you're taking 1 or 2 or 3 doses and then you're done.
Right. Yeah, so people, the different kinds of medicines can be really, really helpful. We talked about how ADHD is very much a condition of being affected by your environment, right? The stimuli in your environment. So setting up your environment for success can also be an important intervention. And that can look like, making sure that if you need to focus on something that you don't have access to very distracting stimuli, putting your phone somewhere else,
Yeah.
Or other tools to help you organize and compensate. So calendars, reminders, sticky notes, things like that.
Yeah. And when you look at meds and therapy, it's not meds versus therapy, but stimulants especially are an interesting example to me because stimulants like the Ritalin methylphenidate category and the Adderall amphetamine salts category with related things like Dexedrine, Vyvanse. Those types of meds are 3 times more effective than any other treatment, including psychotherapy alone, because sometimes they're what is needed to get someone to a place to be able to really use the therapy to get to a place of not just swatting away the symptoms, but really flourishing and thriving. They open the door to some of these other treatments. And compare that to something like, binge eating disorder. I choose as an example because Vyvanse, previously approved for only ADHD, in recent years was approved for binge eating disorder. But cognitive behavioral therapy still remains the gold standard for binge eating disorder, not Vyvanse. Like CBT beats Vyvanse hands down in its effectiveness overall. And although you could do both.
Right. Yeah. I heard Barkely describe, he went hard in the paint on this one. He described stimulants for some people who are responsive to them, who have ADHD, akin to insulin for a type 1 diabetic. Like this person needs this medicine. It compensates for a defect in their body. Why would you not give it to them?
Yeah. And that is, I like that he's pointing that out because of this movement of anti-meds or anti-ADHD. And mind you, I'm not pro anything or anti anything. Yeah. I like to try and see it from both sides, and definitely only use these medicines when it's really needed, and to use them cautiously and prudently. And the fact of the matter is, stimulants, while so effective and so quickly effective, there are also some risks of abuse, misuse, loss of appetite, even some slight stunting of growth at a certain age, a certain dose. And if you take too high of a dose of stimulants, they can be emotionally blunting. So there are some interesting strategies I like to use, using the other classes of ADHD treatments, like there's atomoxetine or Strattera, there's guanfacine or Intuniv, there's clonidine, that are people don't like as much as a stimulant, because they don't have that flood of dopamine that is kind of motivating, feels good, energizing. But they have such a different effect on the limbic system and the emotional regulation, that they more target that emotional dysregulation without numbing it, blunting it. So even though I agree with the strategy of avoid multiple meds when possible, sometimes, and for, I'd argue even many people, it might be a better strategy to lower the dose of one thing and add on another complementary thing, and because one pill doesn't necessarily get all these circuit domains that we're talking about in and of itself.
Right. So we've talked about some of the treatments that probably have the most research support, right? These certain medications, behavioral training, setting up your environment for success. And then there are some that have promising, sort of maybe early or maybe even controversial support, or not a whole lot of support at all, but some people report that it helps. And so these are some of the things that just make you a healthy human generally. So we talked about sleep as an example. Your diet. There are some connections between diet and some dietary triggers that can exacerbate symptoms. They don't cause ADHD. Red 40 does not cause ADHD, but in early childhood, there have been some connections between food dyes, for example, like Red 40, and the exacerbation of symptoms in autism spectrum disorders as well, for that matter. And then there's new research being done on the gut-brain connection, the gut-brain axis, and neuroinflammation being implicated in not only ADHD, but other conditions like depression. So if you don't have a healthy gut microbiome, it can lead to neuroinflammation or systemic inflammation, which could exacerbate your symptoms. I did a little bit more research. Low iron can exacerbate symptoms. Lack of healthy omega 3s fatty acids?
3 and 6, yeah.
Yeah, 6. So if you have too many, you want less 6, more 3s, from what I understand. But supplementing with omega fatty acids has been kind of a default.
Yeah, those are my favorite supplements, first line to go to for ADHD, even though there are many to think about.
Right. Yeah. Any other treatment approaches? I guess we didn't talk about neurofeedback.
Oh, yeah.
Probably give that a shout out.
Yeah, that's a fun one. I used to work with it quite a bit, actually, when I was doing work with a number of teen boarding schools, and I was prescribing a lot of stimulants and also doing as much therapy as I could. But at one point, we were bringing in neurofeedback, which is this kind of brainwave therapy, brain training approach to ADHD that's, I think, a beautiful approach that requires patience, because you're essentially putting this EEG cap on that's hooked to a computer or video game system, and then you're either playing the game or going through some computer exercise or even watching a movie while monitoring your brain waves, and the game or the software responds to your brainwaves. When you get inattentive, the movie picture will get fuzzier, or your motorcycle will crash. But when you dial into that more focused zone, your plane flies straighter and takes off. I actually owned one of these for a while and would have it in my basement and would play with it personally, or put my kids on it, and we could try and fly a plane with our brains. It was pretty cool.
That is cool. Yeah, I like neurofeedback and biofeedback because it's a good way of, taking advantage of those reinforcement variables that are so good at teaching us things. So if you're doing something enjoyable and the screen gets fuzzy and it's like, oh, I know what I need to do in order to bring back this enjoyable thing. It's a good way to train your mind, I guess.
Yeah.
It's also an awareness trainer. For a lot of my clients that don't have a great awareness of their emotions, we will sometimes tell them to pay attention to physiological cues. So if you put them in like a biofeedback setup where you're measuring their heart rate or their skin conductance or something like that, muscle tension, then you can draw their attention to these connections, and then they develop greater awareness of their psychic world.
Yeah. And it's a slower path, but a tried and tested one because of that idea or that discovery in neuroscience that was so game-changing of neuroplasticity, and that neurons that fire together wire together. So if you can put a kid or an adult in a kind of training laboratory, and these can even be done at home or in clinics, and get into that place, you know the way, and you can get back there more and more readily and spend more and more time there out in day-to-day life. But I'll admit that sometimes it takes an initial intervention, many times with medicines, for example, to be able to tolerate some of these other important treatments that might take things to the next level.
I've thought about that, like comparing what I think psychedelics do for some people to what maybe stimulants can do for people with ADHD, in that for some people, psychedelics show them what could be, something that they could not, or at least would have been very difficult for them to experience on their own. And the way I like to describe it is they can sort of drop breadcrumbs on the way out of that experience, because the medicine doesn't last forever. And now they have some sense of maybe what it feels like, so they're more likely to be able to get back there. Do you think stimulants could potentially serve that same purpose for someone with ADHD?
So I like that analogy, and I like this way shower concept. And in fact, when I prescribe stimulants, and this is just my personal bias, but I always include in the plan some med holidays, right? Like some people take it only on weekdays. Some people need it on weekends because it's really impacting their interpersonal relationships, and their so many times it's like for adults with ADHD, it's interfering with their spouse or significant other. But just having some kind of planned washout or break, because the fact of the matter is when you take a stimulant, your brain gets used to having the dopamine delivered to it on a silver platter. And that's great when you've had all these executive function dysfunctions, and now you're like, whoa, light switch goes off. This is what like a focused, intentional life could feel like. And I do believe a treatment goal of mine when I work with folks is to learn to do that on one's own without the medicine, whether that takes a long time or not. And regardless, I like to wash it out, let the brain start cranking out its own dopamine again. And that could be done on a vacation or as you get ready for an ayahuasca ceremony or whatever else. But I do think there's a lot of value in that, and they are showing the path in some ways. Yeah.
Right. Any other treatment options that people have that you want to share?
It's like we've been talking about, managing your environment and putting the interventions out in time in the real world. I'll give an example from my life. Well, I might as well just share the beginning of the story too. When I was a teenager, my younger brother, he was in kindergarten at the time, and one day in kindergarten class, they were making like macaroni art or something like that. I may not have all the facts straight, but the fact of the matter is he was a budding young ADHD kid with all the superpowers that come along with it, or the potential there, and and the ability to frustrate a teacher. And he had this brilliant idea to start, to make macaroni art in the air and have everyone like blow it across the classroom, and made the teacher cry. And then she sent him to a psychiatrist. His name was Dr. Laws. And what I thought was pretty cool about this is Dr. Laws brought in the whole family. Me, my 4 siblings, including the one being evaluated, and our parents sitting around this conference room table doing uncomfortable family therapy. And this psychiatrist, I liked how he'd do this really cheesy thing with my brother, be like, "You want to have a thumb war?" And he'd have one. It's in fact why I have this thumbs up in the back of my office, because that guy, that psychiatrist, was kind of influential for me. He doesn't know it. He's probably not listening to this podcast. I don't know where he is. He was in Canada. But I worked for him for a while doing some flyers. He was an ADHD expert and would speak about it, and I'd do some graphic design for him or whatever I could. But that's not even the story I was going to tell. Fast forward till, I finished high school in Canada, and then at 17, I'm ready for college. Like going to turn 18 pretty soon. I get shipped out of the country to the USA, go to this big, difficult school. You went to BYU, right? It's, there's a lot of smart people there. Very hard to get into ACT score-wise and all that, GPA. So I'm thinking, I had good grades in high school. That was pretty easy. I didn't have to do much. So I get in this like biology 100 class. There's 500 people there. And I think I can apply the same approach that I did in high school. No way. I got my butt kicked.
Bio 100 was my butt kicker too. That's the one that woke me up.
I got a D. And
yeah, I got a better grade than you did, Reid. But it wasn't an A. It was my first, I think it was my first C ever or something like that. I was devastated. Maybe it wasn't a C. I think I got a B. I don't know.
I like to admit that I got a D in biology when I'm in these healthcare settings where I'm supposed to be a licensed physician.
It's what convinced me not to go to med school, actually, because I was going to be a psychiatrist, and I got this crappy grade in biology, and I'm like, I'm more interested in philosophy anyway. I'll be a psychologist instead. Anyway, sorry I hijacked your story.
No, that's so you know what I'm talking about then. Because I was there with all these smart people, and they don't really notice if you're not doing your homework or struggling. And I didn't appreciate how much work was going to be required outside of the classroom. And I also got a D in Econ 110. I'm just going to spill it all out
Confessions there. Confessions with Reid.
Because I came home for Christmas break, flew home to Canada, and I was like, I didn't say this at the time because I didn't swear, but I was like, holy shit. Or whatever the equivalent was back then. I was like,
gosh darn it.
What just happened? And there was this fire in me. Like, I was like, heck no, I probably said. I know what to do. And I just got a Franklin planner system. My dad used them. He hooked me up with the best ones. And I just mapped it out. Like an hour to a study outside of the class for every hour in class. And then I did it. I got so many social invites because, that was a fun first semester, like playing volleyball on the lawn or going on a different date every night of the week. And just like having a freshman experience, BYU style, of course.
Right, yeah. It's a little tamer.
But so I had to stick to the discipline. I even had this mantra of like pummel procrastination with some roommates, and I just did it. I was like, I am going to hang out with you all with a vengeance at 6:00 when I finish this last hour of study. And I retook biology 100, got an A. Retook economics, got an A. I had to then take biology 130 because of med school. They required it. So it was all a waste, but a beautiful lesson. And it, even though I even went to go try and get an ADHD diagnosis that freshman year because I was like, what the hell is going on? I was more in that sub-threshold, not diagnosed, no meds category, but it just taught me that the environment matters for these things and how they manifest. And while I could coast along in high school, you put me in that competitive environment where I have to use new executive functioning skills. I got my butt kicked, and had to learn a new way.
It's something we see in a lot of kids with ADHD who happen to have a high IQ, which, intelligence, the various ways we measure it, is pretty heritable as well. Certainly influenced by a lot of factors, but a lot of kids who sort of coast through high school because they just are bright, good for them, have a rude awakening when they go to college, because they can't just sort of BS their way through a paper or, use their inductive and deductive reasoning to figure out multiple choice tests really, really easily. So yeah, good for you for buckling down and making it happen.
Yeah, and thank you, Steve. And along the way, you learn what works. Like some people need a quiet room to study. Some people are highly distracted in big open libraries or cafeterias. Some people need some noise canceling headphones.
Some people need to move. Like I know some people, like I was saying earlier with the Kelley Starrett example. I had a friend who would stand up and walk around the room while he studied. He had to be in motion, and because if he sat down, he was just too restless.
So when I went to med school, it was a whole nother level of challenge that I had to learn. I had to learn, I really have to move. So I started bringing my mountain bike every day, and this is up at the University of Utah where we had beautiful trails right out the door. So it would be in my car, on my car, and it was my ADHD and mental health treatment of choice is to get on the bike at golden hour every day after, along with some breaks during study marathons. And sometimes I'd just read my notes or key points into a recorder, put on headphones and get on a bike and let it soak in another way. Because it was a whole nother kind of laboratory pressure test that's showing me where I was lacking some executive functioning skills to be able to manage that environment.
Right. Yeah. So great examples of creative approaches to learning where to compensate for what might be lacking.
Yeah. And you do have to figure it out what works for you. There isn't really a one size fits all, but there's a lot of literature, a lot of guidance, a lot of options. But I think the key takeaway for me is that, ADHD is a decreased ability naturally to organize oneself over time and regulate oneself, and those are manageable but the interventions need to be in the environment in the real time here and now.
Right. Well, we want to point people to some resources because certainly we haven't done an exhaustive lecture on ADHD and what can be done about it. Russell Barkely, who we've mentioned a couple of times, has a website with all of his books and other resources on there, like fact sheets. He's got some ADHD fact sheets that are really up to date. I mean, he stays up to date on that literature. So russellbarkley.org is his website. There's a fun cartoon, this sort of comic website that a client introduced me to a long time ago called ADHD Alien.
Oh yeah, that's funny
cute
stuff.
Little alien that sort of, makes very funny and relatable comics related to ADHD. And then there's a YouTube channel I stumbled on a long time ago. She now has over 1 million subscribers. This is Jessica McCabe's How to ADHD.
Oh yeah.
And I just visited it again today just to kind of see what she's up to now. Still lots of great content, very relatable, very vulnerable. But now she's got a website, she's got a Patreon, lots of good resources connected to her. She did a TED Talk too on ADHD.
Oh, awesome. Yeah, those have been so helpful. The artists, the people vulnerably admitting what it's like to live with ADHD, so people can realize they're not alone in it. And there are ways of seeking help or things we can do in our lives to improve our environments and navigate life the way we really want to. And a couple other resources I'll add. Chad, is the main ADHD society I'll think of children and adults with attention deficit hyperactivity disorder, CHADD, and then ADDA, the Attention Deficit Disorder Association.
Awesome. Well, I think we did a good job, Reid. I'll praise you here. Let's take turns. Good job, Reid.
Good job, Steve. Thank you. Always a pleasure.
Always a pleasure. Thank you, dear listener, for listening. It means a lot to me. Psychedelic Therapy Frontiers is brought to you by Novamind, a mental health company that specializes in psychedelic medicine and research. You can learn more about Novamind's mission to increase access to legal, safe, and evidence-based psychedelic medicine at novamind.ca. If you like what you heard, please subscribe to the podcast on whatever platform you're using to listen or watch. Also, if you're feeling generous today, please leave us a glowing review on Apple Podcasts, Stitcher, or wherever you like to listen. If you'd like to reach out to us with questions, suggestions, criticisms, etc., please email us at psychfrontiers@novamind.ca. Thanks again. The content of this podcast does not constitute medical advice or mental health treatment. Please consult a medical or mental health professional if you believe you are in need of mental health treatment.